Hi, I'm going to talk to you about shortness of breath and how this can sometimes be caused by a cardiac problem. The first thing to say, there are lots of causes of shortness of breath and not all of them are related to the heart. It's important that your cardiologist goes through all of that as well to define whether it could be a problem with the lungs or problems with things like a low blood count, such as anemia, that can cause it. But there are cardiac causes which can cause breathlessness. The two major ones, or three major ones rather, are either some form of rhythm disturbance. Sometimes you can get problems with the heart function, the pump function of the heart not being as strong as it should be, so-called heart failure, where this causes a build-up of fluid in the lungs and can make you breathless. There are other causes, such as varying types of angina. So normally people get classical chest pain, but some people can present with abnormal or different types of angina equivalents, particularly in diabetic patients where sometimes the nerve endings are sometimes a bit don't work as well as they should, and this means that they then feel the pain of angina as breathlessness rather than classical chest pain. Your cardiologist will sit down with you and go through again your history and talk to you about the various tests, which usually will involve an echocardiogram to look at the pump function of the heart, an ECG, sometimes some kind of rhythm assessment in terms of doing a 24-hour tape or a 48-hour tape, and then can define what's going on. And if necessary, if it's suggested, you may need some kind of ischemia testing, in other words, to look to see if there's any evidence of a lack of blood supply to the heart, in other words, angina. And those can then guide you as to whether or not the breathlessness is sometimes or is going to be related to a heart problem. In some patients you find it's more than one thing. It may be breathless because of a bit of a problem with their lungs, plus their heart, plus they might be a little bit overweight. But a cardiologist can be holistic and look at everything together and then define how to best treat those things for you.